And we're going to get started in just a minute. Thank you everyone for joining. Atlanta, Austin, New Zealand. Wow, that's something. Okay, let's get started. It's 7:04. I think we have the majority of people logged in. So welcome everybody. We're so happy to have you. We're honoring National Infertility Awareness Week, but we at Kindbody really like to change the conversation. We don't love the word infertility. We try to keep it up to a positive and sort of a different lens to look at it from. So we look at it as Fertility Awareness Week, and we call these events Fertility Unfiltered, because really the key of National Infertility Awareness Week is to raise awareness and to have these conversations that sometimes are more difficult to have, and that people are sometimes a little bit more hesitant to discuss with their friends and family. And so we like to create a space where we can share these stories and raise awareness and open up the conversation. So that's really the goal of this week and this session. And we want you to hear from real patients and our physicians and ask all the questions you need to ask and hear the stories that are so important. So Riv, if we could go to the next slide, I'll introduce our speakers. So we have Dr. Geraldine Ekpo from Kindbody, San Francisco. We have Dr. Ruhi Jalani, who is currently at Vios, but I don't know how many of you know, but Kindbody and Vios recently merged. And so soon everybody will be under the Kindbody umbrella. But as of now, Dr. Jalani is at Vios. And our two amazing patients, Claudia Calderon and Tara Engelberg, who will be telling their stories today. So welcome everybody. We're gonna allow them to all introduce themselves and give a little bit of their background. So Dr. Ekpo, do you wanna kick it off and give a little bit of a deeper introduction? I think you're on mute, Dr. Ekpo. Let's find her.
Perfect. It wasn't giving me the option. It wanted you to unmute me. So thank you for doing that. Thank you all for joining us today. It's a pleasure to be here. I'm Dr. Geraldine Ekpo. I am the fertility specialist who works out of the Kindbody San Francisco office. I am new to Kindbody. I have been in the fertility field for over 10 years and really like sort of the mission of the company, which is why I made that transition to join the practice here in San Francisco. By way of background, I was born in Nigeria, grew up in Atlanta, Georgia, did my training in the Midwest and slowly migrated to the West Coast because the weather is better here. And I have been here for the last 10 years now and at Kindbody for the last 4 months. I'm very, very honored to be here to raise awareness about fertility as Sydney described. So thank you for being here. Dr. Ruhi will take over. You may have to unmute her.
Awesome. Thank you for unmuting me. I am Dr. Ruhi Jalani, and I am a doctor at Vios Fertility Institute in Chicago, soon to be Kindbody. And a little bit about me, as many of you know, I'm a fertility doctor and a fertility patient, have been so for quite some time. I am on my third baby through IVF, and we'll go deeper into this, and I'll pass it back to Dr. Ekpo to talk a little bit about our mission and what the purpose of this presentation is.
All right. Okay, so I'll quickly just go over Kindbody and what we are and what we do, and then I'll have Sydney introduce our panelists. So Kindbody, we are on a mission to make healthcare, fertility care accessible. We're on a mission to make it affordable. And we do that in many ways. We try to be different from your standard fertility clinic, where we look at women from a whole body experience. So we're just not doing your IVF treatments or your IUI treatments. We're actually supporting you throughout that journey with holistic management and also support from a logistical standpoint with figuring out insurance benefits, etc. We understand that fertility care can be overwhelming. We understand that sometimes it's not affordable. And we are very, very pleased that a lot of companies are recognizing the need for families to be supported with insurance benefits. And so one of the things that makes Kindbody, one of the things that makes us unique is that we market directly to employers. And so we work with specific companies through which their employees can get benefits to provide their fertility care. As we know that it makes a big difference. You can get those benefits and have that support from your company. So rather than leaving it just to the individual, Kindbody tries to make their employees, make us aware, make society aware of what fertility is, especially in states that may not be mandated. And we'll talk a little bit more about a lot of the terms that I just threw out there, like IVF and IUI. Next slide, please. And to that extent, what we do is not just fertility. So we are also known for having gynecologic care, well women checkups, getting your IUDs replaced for those who are not at a time where they're ready to try to conceive, pap smears, and also wellness and nutrition as we support the journey of fertility. Specifically for fertility, since this is what we are focused on this week, we see all couples, we see all types of couples, single women by choice, same-sex couples, single men looking to use surrogates and also looking to use donors to help them start their families. And people who just want to know where they stand from a fertility standpoint. What are my options? I'm not ready to have kids. What's my egg count? And when I'm ready, how do I go about it? So that's typically how we start that journey with you. And then we follow you typically through the point when we get you pregnant, and also do a bit of postpartum support as well. And yeah, that's our mission. That's the mission that we're going to continue to pass on. We recognize that there's a lot of stigma. There are a lot of barriers to fertility care. And the way we look at it in our society, we wait till there's a problem, and Kindbody wants to change that conversation where we're having those discussions with our physicians before you actually need fertility care. And so our goal is to make this a welcoming, inclusive experience, from walking into our clinics, which are very, very, very pleasant to walk into. We want you to feel like you're talking to a colleague, talking to a friend about something very intimate, and not going into a very stiff environment to discuss your entire reproductive history. So we are very, very pleased to be able to provide that care, and we're thankful that one of our patients actually through the Kindbody San Francisco office is going to be speaking about her experience as well. And after that, myself and Dr. Giuliani, we're going to go over fertility and how we can support you and any of your family members that may be going through that journey right now. So this is, I think we start at this point to talk about the journeys and why it matters. We don't want this to be a physician, me reading off a slide and telling you what to do and telling you about your egg count and how it's going to go down and all bad news, which is not always what we do. We want to have these conversations openly. We want to make this not just an infertility talk, but a fertility talk in recognition of National Infertility Awareness Week this week. So one of the things that I found in my experience with patients is people come to us because they tell their friends, or their friends tell them they've had a good experience at a particular place. I went to this place and they heard my story. They saw me as a person, and I can talk to you about my experience so that you can take that experience, take that information to decide what direction you'd like to go. And in the same way, we have patients today who are going to talk openly about their challenges. And we're definitely going to save some time later on to talk and answer questions.
Thank you, Dr. Ekpo. So Dr. Giuliani, I don't know if you want to give a little preamble to Tara's journey as her physician, but I'll let you take it over.
Yeah, I would love to introduce her. So one of our co-panelists is Tara. She is a dear patient of mine, and I'm happy to say she's no longer my patient. Tara's graduated onto her OB and hopefully will be back, but she's had quite a long fertility or infertility journey. We started, I think I met her on year 4 of your journey, right, Tara? And she was 5 years in. So this is officially, fingers crossed, she is pregnant and onto her OB, and I'll let her share a little bit of her ups and downs. And she's had quite a bit of a roller coaster, and I'm sure we can all relate to that.
Hi, everyone. My name is Tara, and just before I get started, I'm losing my voice, so I apologize in advance. It has been a very long journey. My husband, his name is Glenn. He unfortunately could not be here today, but I'm happy to share on our behalf. We started our journey in 2016, shortly after we got married. And like most couples, we thought it would be pretty easy. But unfortunately, to our surprise, it was anything but that. We tried for months and months and months, then turned into years, and nothing was happening. And it felt like everyone around us was getting pregnant, and it felt like everyone was getting pregnant really easily. And we really struggled in that time. It was honestly probably like the most dark time of my life. It was just so hard. We didn't know what was happening. We felt embarrassed and ashamed, and we didn't feel comfortable talking about it with anyone that we knew. We didn't really know anyone going through infertility. And to be quite honest, we were even just afraid to say that we had infertility. Like, we were really shocked that this was something we were going through, being like two healthy young people. So we kept on our journey, and I think it was about 3 years in of trying naturally and doing everything we could at home, that I just kind of reached my breaking point emotionally. I couldn't keep going the way we were going, and I needed more support, and I needed some answers, even though I was terrified to know what was going on. I remember being like so afraid to even talk to my OB, just because I just felt so broken, like there was something wrong with us. And it was really hard. But once I opened up to my OB, she was able to kind of guide me in my next steps, because I really didn't even know what steps to take. Everything just felt so overwhelming. But we took that brave step, and we saw a fertility doctor. At the time, we were living in Colorado. And I'll be completely honest, I was a little bit of a deer in headlights. I had no idea what to expect. And I was quite overwhelmed by just the whole process. It felt like a lot of tests and a lot of scary words I'd never heard of before. And although I've heard of IVF and IUI and fertility treatments, I really didn't know anything about them. And of course, I imagine most of us had dreams of, falling pregnant naturally, and, honestly was kind of grieving that I might not be able to experience that. And so we got started and tried to work my way through all the emotional ups and downs of just that initial process. And turned out that, it was recommended that I do a hysteroscopy and do laparoscopic surgery, which is kind of like an exploratory surgery to see if we could find anything going on, since everything was coming up pretty good at that point. And it was after my lap surgery that they found that I had stage 1 endo, which was a complete surprise. I had no symptoms of endometriosis. Fortunately, everything else looked really good. So at that point, we were diagnosed with unexplained infertility, and we were given a 1% chance of conceiving on our own. So just hearing that stat alone, I still get emotional about it because it was so hard. Sorry to hear that after trying so hard and wanting this dream, and kind of realizing that our next steps were looking kind of big and scary. And so we kind of took some time to ourselves to try to figure out our next steps. We continued trying at home, and it was really difficult after that surgery, because of course you always find the hope. And we thought after that surgery that maybe things would be cleared out, and that maybe it would happen, that 1% miracle, and it just didn't happen. So after a lot of soul searching, we decided to move forward with IUIs, and I was terrified, but I felt like, okay, like I can do this. So many other people do this. We can do it too. And we got started, and we were in the process, and the day before IUI, the pandemic hit and everything shut down. And it was devastating to be finally at that point where we felt comfortable to start this process. And we're already in it, just to be told that everything's shutting down and we don't know when things will begin again. So, we mourned that, continued trying at home. And I guess the silver lining is when everything opened, we were really ready to begin our treatments. And so we started with, we started up with IUIs, and unfortunately, those also did not work, which was absolutely heartbreaking because, you feel like as you go through the process, every step you get a little bit closer, you get some more information. We had a higher percentage chance than trying naturally for it to work. And I just didn't understand why it wasn't working. Like, two healthy people, unexplained infertility, it should work, but it didn't. And so after a couple IUIs, emotionally, I was just at that point again where I just didn't know if I could continue on that route. And so we decided at that time to explore IVF, which was hard on its own. I remember crying in my kitchen with my husband saying, I don't think I could ever do IVF. I didn't think I was brave enough. I didn't think I could do the shots and medications. I was absolutely terrified. But I also knew, given our history, and I think at that time it was year 4 already, I just knew that deep down that this was what we needed to try next. And so we started that process, and once again, big learning curve, but we got through it. And thanks to so many other people in the community, other warriors going through it, we had a lot of support. Because honestly, like, I had no idea what I was doing. It took a long time for me to figure out how to do the shots and how to do everything in the process. But we got the hang of it. And before we knew it, we were at our egg retrieval, and that egg retrieval was exciting, scary, but we were really hopeful and just eager to kind of get an idea of maybe what was going on. Maybe we can learn more about my eggs or what was happening in the lab, just kind of see what was happening. And it was during that cycle, we ended up, I think, getting 16 eggs and 3 blasts, and 2 came back PGT normal. So we were really, really, really excited, but also at another crossroads, because being on this journey for so long, and I've always dreamed of having a large family, we knew the statistics that, sometimes it can take a couple tries for a live birth. So we made the hard decision to do another round of IVF. And so we took a little bit of a break, which I definitely needed. And we geared up for round 2. And in that round, the second round, we felt a little bit more confident. We felt better. We knew what to expect and what we were doing. So that was a big help in the process. And during that second round, my ovaries did respond a lot better. We didn't really change much, but I think maybe because it was stimulated before, I don't know. But I think we retrieved 21 eggs, and to my great surprise, we got 4 PGT normal embryos. So we had 6 total. And we felt at that point that we were ready to transfer. And so we went into that next kind of chapter of IVF, of embryo transfers. And so it was different than doing stimulation process. It was, in my opinion, a lot easier, but obviously, like, emotionally still hard in a lot of ways, but exciting. This was our first chance at, like, having the highest statistic we could to become pregnant. So last April, we went into our first frozen embryo transfer, and we were incredibly hopeful that it would work. And we didn't know, obviously, being unexplained infertility, but we were just so hopeful. And to our surprise, the first time we've ever been pregnant worked. Our first FET, we were pregnant, and so overjoyed, on top of the world feeling. Our first beta came back pretty strong, but unfortunately, a few days later, our betas dropped and we lost the pregnancy, sorry. And that was really hard. We did not see that coming. We honestly just thought it would work or not work. We didn't think that we would get to that point after so long and see our first positive test just to have it taken away. And it felt really cruel. And it was really hard on us. And it took everything out of us, to be completely honest. So from there, we knew it was time for a break. And so we took about 6 months off to just kind of sit with everything and figure out our next steps. And honestly, that break was really hard, but also like so needed, because it's such an emotional process. Infertility, going through all of this, it's a lot. And in that time, my husband and I decided to come home to Chicago. That's where we're from. And that's where I met Dr. Jelani and started at Vios. And from the moment I started with them, I just had the best experience. They are absolutely wonderful. I love them to death. And we got started pretty much right away, which I was ready for at that point. We did a bunch of tests, and a lot of tests that we had never done before, which I really appreciated after, our loss and just being through everything that we had. And Dr. Jelani actually caught something that no one had caught before, was that I have polycystic ovaries. I don't have the whole syndrome, but I have ovaries that I think respond similarly, and therefore it can affect my egg quality. So as hard as that was to hear, I was also really grateful for the information, because it can help adjust protocols and plans in the future. So once we got that updated diagnosis, we decided to go forth with another egg retrieval, which was a big surprise to us. But given our loss and kind of learning about my eggs, we decided that we wanted to try to bank some more embryos to just be proactive, just in case, our journey didn't go, as we would hope. So we did that third round, and I was very excited and nervous at the same time, but just excited because Dr. Jelani had a different plan for me, and I was excited to try some new medications and do things a little bit differently. And I think we had a great outcome from that round. We retrieved, I forgot how many eggs we retrieved, but it was a lot, and ended up with 3 PGT normal embryos. So at that point, we were definitely ready for another transfer, although scared. We were excited but nervous, and we did a different protocol that time, which I was really excited about. It's a natural medicated cycle, and I feel like my body responded so well to that, and just had a really good experience with that protocol in general. And we went into that transfer around Thanksgiving, and super nervous and hopeful. Our surprise, we were pregnant again, and super excited. But unfortunately, once again, we lost that pregnancy. Sorry. It was hard, just because we're like, what's next? Why is this not working? When is this going to work? I was thinking, like, what did I do wrong? What's wrong with me? Just a lot of emotion. And, obviously grieved, and Dr. Jelani and everyone at Vios was so supportive and amazing, like literally cried with me. And I appreciate that so much. And at that point, though, I knew I wanted to do some more testing. So Dr. Jelani was great and went on board with just doing a month's worth of like tons of testing. I think we did like a dozen tests or something like that. And some of them we did another hysteroscopy. We did an ERA for the first time, the Alice, the Emma test, and a bunch of other tests, and took those results and adjusted my protocol and our next steps from there. And I think one of the biggest interesting things for me was that my ERA results came back as post-receptive, meaning from my understanding that I needed a little less time on progesterone. And so we adjusted that going into our third frozen embryo transfer, which was in January. and that little baby stuck. So, so emotional about it. We were so thankful and surprised and happy, like all the things, like didn't think that it was going to work after, I was hoping it would work, but I was cautiously optimistic after 2 losses. And this embryo, our little fighter, and surprised us even more, split into identical twins, which was the shock of our life. And once again, overjoyed, excited. But unfortunately, at 7.5 weeks, we lost baby B to vanishing twin syndrome. So lots of highs and lows, and emotionally was tough grieving the loss of a baby while also celebrating the milestone of being pregnant with the other. And it's been hard. I've been enjoying my pregnancy and I'm so thankful, but it is emotional to think about, there should have been 2. So, but we're so thankful. We are 17.5 weeks pregnant right now with our little girl. Sorry. And it's been a long journey, but we are so grateful to Dr. Jelani and Bios. The entire team from like day one has been so amazing and supportive, cheered me on through all the ups and held my hand and cried with me at all the down parts. And I've been to a lot of doctors and clinics and just felt so supported at Bios, and just I truly felt like they care and cared and are there for us. I didn't feel like a number at all, and I'm just so thankful for them, because I really don't think we'd be here today without them. So sorry that was really long, but it's hard to wrap up 5.5 years in a couple minutes.
Thank you so much, Tara. That was beautiful. And I'm sure that you could see in the chat now, I'm sure you weren't paying attention, but if you go into the chat, you're getting so much support and so many people who have been through similar, and you are just beyond strong. And thank you so much for sharing your story. And I'm going to pass it over to Claudia too, because I'm sure we're going to hear something beautiful from her as well. So Claudia, I'm passing it over to you now.
Yes, thank you. It's so emotional. First of all, thank you for having us share a story. It's really important for people to understand that it's not just a transaction. It's not just something that people go and do. It's putting your whole life into this one tiny life experience. So for me, it's a little bit different in the sense that I knew nothing going into this process. I was very much encouraged by one of my sisters who also went through an IVF process, but just like Dr. Ekpo mentioned earlier, there's still a lot of stigma around IVF, infertility. My husband's here shaking his head, but I'm speaking for the both of us. There's still a lot of stigma. We come from a Hispanic Latinx household where, infertility could be something that you go to a church and pray about, or, you may have someone tell you, well, maybe you need to go to a curandero, which is like a witch doctor. So sharing it is still very much a taboo. It's not very much talked about. So when we decided to go through this process, it was very much a decision between my husband and I of let's do it and see what happens. We knew we wanted to have a baby. We're both in our late 30s. In my career, I never really took a chance to stop and think about fertility or stop and think about my future as a mom. So it wasn't until we got married that we were like, oh my gosh, we have to do something about this. So through my employer at that time, they had this session with Kindbody, and I just happened to sign up for the Zoom and kind of join the conversation it sparked a curiosity on, well, maybe I should get this checked out. And again, like Dr. Ekpo said, sometimes it's not until you find something wrong that you start doing something about it. So as I started getting tested, I started to realize that, well, first, my sugar levels were very high. So I needed to have some sort of nutrition change. And that kind of like sparked a very much a change in me of lifestyle, of just holistically how I wanted to have this journey start. And then also, you know, just kind of learning more about my body. I knew very little aside from going to the doctor every year and doing my PAPs and getting my traditional checkups. I knew nothing, and I still am learning a lot of the acronyms, still learning a lot of the definitions. It's still a work in progress. So our journey kind of started during the pandemic, actually, around 2020. And then our first visit officially to get all tested, along with my husband, was in San Francisco, 2021, January 2021. That's kind of when it kind of hit. At that point, I had already made a few adjustments to my diet, to my well-being, and overall just our lifestyle as well, even including work. I made a transition from New York to the Bay Area as well. So we started our journey in San Francisco. And from day one, it was something that we had no idea what we were getting ourselves into. We had no idea every day there was a new learning. Every day there was something that, you know, what worked for my sister doesn't necessarily mean that might have worked for me. All we knew is that we had each other's support. And that was a learning lesson, is that you can't compare your journey at all with anybody else's. Every journey is incredibly unique. Every journey is incredibly different. So that's when it all started. And the nerve-wracking, the emotional, the physical, everything just kind of pivoted. So we started our journey with 2 IVF cycles. From the moment, you have your egg retrieval to the moment you find out what I call my babies, my frozen babies. And you start realizing that, oh my gosh, like I genuinely wish I would have done this when I was younger, or had I had a conversation with someone about this when I was much younger and learned about this. Again, every story is different. We didn't have, it was also unexplained infertility. There wasn't really a particular reason, other than my AMH levels were lower than 1. So we didn't know what to expect. At this point, we decided, we're gonna do whatever is in our power, physically and emotionally, and financially as well. We're gonna do whatever is within our power to do what we can to bring a baby into this world. So we did our IVF cycles, 2 IVF cycles, and 1 transfer. So far, we are 26 weeks pregnant. But again, like Tara mentioned, you don't call it done until it's done. Every day is new. Every experience is new. Every learning is new. We had many situations with our clinic where, first of all, my nurse and my doctor were angels for us. They walked us through everything, but there were times where my emotions, along with medications, were up at peak and I didn't know how to react. And sometimes I would go psycho and call them a zillion times with a zillion questions. So I think one of the lessons too is I definitely feel like we need to encourage people to ask questions. There's no wrong answer and there's no wrong question for you. And I think that just following your doctor's orders and following your doctor's advice is always going to be best. And if it's something doesn't add up, I think you always have to keep digging. I think that was something I picked up from your story, Tara, is that, you just know when something is not right. And you just want to make sure that somebody answers it for you, but you have to keep pushing and you have to keep digging. So that's been kind of our journey for now, but definitely open to answering questions. I think I saw one in the panel of, who do you reach out to? And at this point is, obviously, if you have a partner, that's going to be someone that you're going to rely on. But if not, your doctor is your number one, someone to rely on. Your nurses is someone to rely on. And there's a ton of support groups that you can find, but it's a lot. We're still working through it.
Thank you, Claudia. And that's such a good point is, at Kindbody, we're all here for you. We have teams at every clinic. We make sure that we know you, we know your name, we're here for you. There is no stupid question. There's no too many questions. You're not being a psycho. It's a stressful, new experience for everyone. And we're here to answer and be there as a pillar of support for you all. And with that, I'm going to bring in our number one support team is our physicians, our REIs. So let's kick it off. Dr. Ekpo, we can go to the next slide and we can talk about a little bit about fertility and sort of the science behind everything. So I'll pass it over to Dr. Ekpo.
Okay. All right. First of all, thank you so much, Tara and Claudia, for sharing your stories. It takes a lot of courage. It takes a lot of courage to be vulnerable, to be on this platform and just let us know your experiences. And I'm so thrilled that you're both currently pregnant, and I hope things continue to stay that way, and you can sort of see the light at the end of the tunnel. Claudia, you hit on a couple of things that I think I'll use as an intro into talking about the aspect of fertility. And that's just understanding that everyone's journey is different. Everyone's journey is unique. There's some things we all start out with, which is the number of eggs we're born with. We have general average numbers as we counsel patients in understanding fertility. And that's the fact that, we may have different journeys and we may take different paths down as we age. However, we're all born with all the eggs we'll ever have. It's something I learned in medical school. And the first time I heard it, I was like, wow, that's just sort of crazy. But you're born with a lot of them, 2 million eggs. However, by the time you get to your first period, by the time you get through puberty, you're down to only about 300,000 eggs. And so every month when you ovulate, you're releasing an egg. Whatever eggs are not released for that month, whichever way eggs have been recruited, actually atrees or die off, and they stop growing. And so we lose up to about 1,000 eggs a month. When you get through menopause at age 50, you're typically down to no eggs, which is why you start having periods. So from the beginning, nature has set things up in what you could say is a very unfair way as women, as you compare to men who actually continue to produce sperm. They start producing sperm at puberty and continue into past their prime. And women, on the other hand, we are losing as we go along. So whether we're actually on birth control, whether you're actually bleeding or having periods, you are losing eggs. There are different ways as to how your body recruits the eggs once you get off contraception, which we'll talk about as well. So when we talk about the age number, one number that always comes up is the age 35. And, I'm aging, my eggs are aging, I'm getting older, what do I need to do? And I like to think of it as not necessarily a cliff that you're falling off. It's a point where we start to see a decline. And in some women, I think the point we like to make as fertility specialists is that 35 may not be a number. You may start to see that decline earlier. You may start to see it later. And because we don't know where you fall on that spectrum, our goal is try to capture those eggs while they're younger and in better quality, so that later on, when you're either ready to get pregnant or start a family, you're doing them either with eggs that you froze when you were younger, or you're getting to fertility treatment before you get to the point where your quality goes down. So as we lose the eggs, it's not so much the quantity that's the only issue. There's also the concern for the quality of the eggs. As eggs age, they divide differently. And so they're more likely to divide in an abnormal way where you have either too many chromosomes or too little chromosomes. And so one of the things our speakers or panelist patients talked about was the PGT testing, so the quality of the embryo, which refers to the right number of chromosomes. So one of the things we're able to do with IVF fertility treatment is to actually test embryos to find out which ones are genetically normal and are more likely to lead to pregnancies. There are no guaranteed. Tara talked about her experience, even though a genetically normal embryo had been transferred, having the losses, but we use that as our best test currently to find the best embryo to transfer to lead to pregnancies. When I see women for fertility testing, one of the things we're checking to assess sort of your reserve or quality or a quantity, we're checking your AMH, we're checking your AFC level, your antral follicle count, and that's a reflection of sort of where you are with your egg number. So some women can have really high AMHs, still have a hard time getting pregnant, and some people have low AMHs and have no problems conceiving. These are just things that your physicians will be ordering. However, how those numbers apply to you is very different from how they apply for your sister, your family member. And so it's very easy to compare and say, oh, well, I had a higher AMH. Why am I having a hard time? Or this person did this, but just remembering that we're all sort of different as the eggs age with us. And so, and one of the things, the reasons we're doing all these testing to figure out sort of where we are with quantity is to be able to get a sense of how much time do I have is always the question. Can I wait? What's my fertility? And, you know, if we knew the answer, we'll write books about it and just educate the whole world. Is like, this is when you start to go down. You need to have a baby before this age. But we don't know because everybody's curve is different. All we know is that age tends to make a difference. And so as we get older, as the quality and quantity goes down, if we can't preserve or freeze some of those eggs at a younger age, or we can try to test those eggs, the embryos that come from those eggs, because we have no way to test eggs. We can't test egg quality, but we know that poor egg quality can lead to a miscarriage, can lead to chances of passing on genetic abnormalities. And so we use the quantity to help us get a sense of, if I went through an IVF treatment, how many eggs am I likely to get? But the AMH number or the AFC number is not a predictor of pregnancy in and of itself. One of the factors, or what are the factors that impact fertility beyond just what we're born with, right? There's your genetics and there's the environment. And both of our speakers spoke to sort of the environmental changes, moving to a different place and a different job, and the stressors are associated with things. And lifestyle factors that we know can impact diet. We know that lifestyle in terms of marijuana use, if you're a smoker of cigarettes, we know that that affects your egg quality. We know that marijuana use affects sperm motility, and we often don't talk about the male factor as much, but that contributes significantly to the fertility journey. Family history. If your mother went through menopause early, that's usually a red flag that there's a good chance that you might go through menopause early, and your fertility starts to wane about 10 to 12 years prior to that age when she went through menopause. So that's a good reason to see somebody to get an assessment, to talk about your family history, even prior to you starting to try to get pregnant. PCOS, or polycystic ovarian syndrome, can run in families. You know, when we're younger and you don't have periods, it's like, oh, that's great, I don't have periods, I don't have to be bothered. But what does that mean for fertility when the time comes? Some women with PCOS don't have periods because you're not ovulating. And so it makes it hard to get pregnant. And so one of the things we can do as your fertility doctors is sort of assist you with that process where we know you have eggs. How can we get you to ovulate at the right time? And of course, your mental health, huge factor. Hard to quantify. All we can do is just sort of try to minimize as much stress as we can, support you in whatever way possible during those key months when you're going through a cycle. And then, of course, the definition of infertility, which our focus this week is fertility and changing the conversation. But when we look at the term infertility, we define it based on a time period. So it's the inability to get or stay pregnant after 1 year of trying. However, we use that definition for women under the age of 35. So if you're over the age of 35 and you've been trying for 7 months, we don't want you waiting the full year. At that 6-month mark, it's a good time to start seeing your fertility doctor, seeing your OBGYN to start that conversation about trying to figure out what could be going on. And the reason for that is because that's the age where we start to see the decline in the quality that I talked about. And if we can capture and get those eggs out before that age, chances are higher. It's not always, it doesn't mean that over 35 you can't get pregnant. I think we are biased as fertility doctors because we don't want to see you later in life and look back and say, well, we should have done something sooner. So we'll be the first to admit that, yes, it may happen on your own naturally. We just don't know when that will happen. So let's try to get to you before you're at that age when you may need assistance if possible. And of course, the fact that a third of the time, the fertility issue has nothing to do with the woman, has nothing to do with the eggs, and it's usually the sperm. And as a society, as we shed light this week on infertility and fertility awareness, it's just remembering that it takes 2 to tango. In some cases, it takes 3 if you're using a donor or donor egg, donor sperm, or surrogate. But just remembering that a lot of the causes, one of the easiest things to do is a semen analysis. So if you have a male partner and they have not done that yet, that's something simple to try to eliminate as you move forward with your IVF journey. And at the end of the day, everyone's different. Our approach at Kindbody is to not treat you as a number, is to treat you as an individual, as a singular person with a different experience. We don't have a standard formula or protocol that everybody gets on. We hear your story, we meet you where we see you and meet your point of need so that we can provide the best care possible. Same approach at VIAS, our new colleagues, and Rohit, Dr. Jilani is going to speak a little bit more about the sort of ins and outs of fertility treatment itself. I'm going to pass it on to you. If you could unmute her, please.
Perfect. Can you guys hear me? Awesome. So we'll start with, there's various types of treatment when it comes to fertility. We'll deep dive and go to IVF and what it is and how it works. And then we'll kind of broader scope talk about other types. So I always tell my patients there's 2 main types. There's IUI and IVF when it comes to treating infertility, not taking fertility preservation into this. So IVF is kind of amplifying in what Dr. Ekbo just said, that your body recruits thousands of eggs every month. However, we only make enough food or hormone to grow one, ovulate that one, and then we lose all of them. So what IVF says is, well, if the food is the rate limiting factor, meaning our follicle stimulating hormone, it stimulates the growth of an egg, then why not feed your eggs more? So we give you injections that are recombinant FSH, meaning synthetic FSH, to help now grow everything that we see at your baseline appointment. Our body's very good at survival of the fittest. So what it does every month, it recruits about 100, brings only about 10 to 12 at bay. That's your antral follicle count, and then only makes enough to grow one. So when we do IVF, we look at your antral follicle count, we look at your FSH, and then we give you a prescription medication to help grow those eggs. And we try to grow them in a single cohort, meaning all along the same lines, to then give you a trigger shot to mimic your own ovulation, release all of them, except we have you go to sleep, do an ultrasound. At the tip of our ultrasound's a little needle, and we aspirate those eggs out before we allow your body or your ovaries to release them, which typically happens around that 48-hour mark after your trigger shot. So how does it work? Well, these injections are synthetic food. So they grow your eggs. Each follicle should have 1 egg in there, and each egg grows about 1 to 2 millimeters a day. We want them to be mature, meaning we want them to be big enough for us to take those eggs out. And that typically is around anywhere from 14 to 26 millimeters. So we try to get a single cohort in that size group. We monitor your progress with blood and ultrasound, and we make adjustments to your doses. Sometimes if you are not growing enough, or if you're growing too fast, you may see us titrate your medications up and down. A common question we get here, and I'm sure we'll get to this, is, are we taking all your eggs? And like Dr. Ekbo said, that month, whatever your body's recruited, you either use it or you lose it. So we're not taking anything extra. We're only taking what's activated that your body would get rid of by itself if we didn't take them out. So your timeline, typically you'll get a calendar like this. So you come into baseline, meaning we look at your antral count, we look at your hormones. Based off of that, we give you a calendar of your dose of medications, and then you come in to monitor every third or fourth day. I always tell my patients that this seems really intimidating, right? You're probably looking at this and thinking, wow, what a time commitment, but it's actually quite flexible. So Tara will attest, you'll text and say, well, I can't come in this day, or portal with your nurse, and plus or minus a day, because your body's very predictable, is very flexible and doable. So let us know ahead of time if you have any important dates or events coming up so we can work around that. The day of the retrieval. So it's quite a nerve-wracking day, only because your first time into it, and I remember you're not sure what you're walking into. We give you an anesthesia, not us, with the CRNAs, that helps you go into light sedation. It's called twilight sedation. You don't remember any of it. We do an ultrasound. At the tip of the ultrasound's a little straw or a needle, which sucks the eggs out of your ovaries. I always tease and joke and say that's my favorite part, because you're asleep and you wake up from what it seems like the best nap of your life. So it's very quick. It's only 15 minutes, but then you get to go home and sleep it off that day. After the retrieval, if you're fertilizing your eggs, that day your partner comes with you and gives a sample. So that day before you leave, you typically know how many eggs we took out. The next day, you'll typically know how many were mature, meaning split into half of you, and how many actually fertilized and became half of each of you, you and your partner. Then we grow them out in culture, and what we want them to become is what we call a blastocyst, meaning it is now grown up enough to become half of each of you and separate into baby and placenta. That's typically, embryonic stage-wise, happens between day 5, 6, or 7. And the embryologist will call you with how many of them are viable. And if you're doing PGT or genetic testing to determine if they're chromosomally normal, then we biopsy the outer layer, the placenta, freeze your embryo. The biopsy goes off for testing, and it takes a couple weeks to get back. If you're doing a fresh transfer, then we try to line your uterine lining with the embryo on day 5, and we put it back in, and hopefully, fingers crossed, that you're pregnant. And the transfer part's much easier. It's a tiny little noodle that slides in, and then you go home and rest. So what's really important as far as next steps, and we are huge, I think everyone on this panel is big proponents on just learn and understand your body. Everyone's body is very, very different. I was very young when I started my own fertility journey, and anytime I would go and talk about anyone and say like, oh, we're trying to get pregnant, it's not working, they'd be like, oh, you're only in your 20s. It will happen. Just keep trying. So I think learn about your body, learn the why, learn about your own health, and be very proactive. And I'm saying that as both a doctor and as a patient. I think it's very important to understand that. I'm going to pass it back to Dr. Ekbo, but here are our clinics. We're growing. We're probably spanned across everything. I think we have pretty much every coast covered. Would you agree?
I'm going to jump in, Dr. Ekbo. Thank you, everybody. And thank you so much to our panelists. And you are all, I mean, beyond amazing. Our doctors, our patients. Thank you so much for sharing and participating. We're going to now get to some questions, and everyone feel free to drop your questions in the chat. If it's a medical question, I'll throw them over to Dr. Jelani and Dr. Ekpo. But if you have questions specifically for Tara or Claudia about their journey, feel free to ask those as well. We'll get to as many as we can. I know we're already almost at 8 o'clock. We don't want to keep anyone here too long. So we'll go for a few minutes, and then we will just feel free to always DM the Kindbody Instagram. We can answer those questions there if we don't get to them today. So let me start. We had a couple questions. I'll start just going back and forth between Dr. Jelani and Dr. Ekpo. Dr. Ekpo, we got a few questions about, can you improve egg quality and sperm quality?
Can you, well, we burned all the eggs you have, but there are some things that we can sometimes to do. So even though you're recruiting the eggs, that journey from where they start being recruited with their little, what we call primordial follicles, to where they become mature follicles, about a 2 to 3 month process. So smoking is one thing that can affect your egg quality. So that's the one thing you can do. There are some supplements that we can sometimes, CoQ10 is a specific type of supplement that can affect sort of the mitochondria, the inside of the eggs, or how they develop. It's very controversial how much those supplements help, but there's some evidence that or how they help, we don't know, but we've seen some improvement in egg quality, meaning that embryos that are created after a subsequent cycle are more likely to be genetically normal. So those are some of the things that we do. There is some evidence behind acupuncture as it relates to a successful embryo transfer. Not a lot of evidence in terms of helping with egg quality, but I have had a couple of patients who anecdotally have noticed a difference after doing acupuncture. Their AMH numbers go up and they tend to do better. The type of medications you're on, I think, can affect your outcome. So sometimes I think our old school approach of just this is the FSH dose, or the hormone that we put you on, and the menopur dose, that's pretty standard. Sometimes less is more. So we sometimes put you intentionally on low doses to see if that affects how the eggs grow. So it's not always the intent to make 15 to 20 eggs, or sometimes after you make so many eggs, they're not good quality. We see a difference when we decrease the dose. PCOS, sometimes putting patients in metformin, optimizing your blood sugar levels, can affect the quality of eggs that are produced. There's so many things that I would say talk directly with your fertility doctor about your specific situation. Sperm, definitely it all depends on the lifestyle of if there's been surgery or any issues that's affecting what we call the DNA fragmentation, sort of from the point where the sperm is produced to when it's ejaculated. It's a journey. And are there things in the way that can affect that process? So men who are smokers, we've seen improvement when they stop. Men who use a lot of marijuana, a lot of heat to the environment, can affect the quality of sperm. So optimizing those things prior to a treatment can definitely lead to better outcome.
Thank you, Dr. Ekpo. I just want to touch on before, just in case people have to leave, we do have a promo code here for our audience, and feel free to stay. We'll keep doing questions, but I just want everyone to have this code just in case. For $100 off your assessment, that's how you get started at Kindbody. You'll come in and you'll do your AMH levels. We'll do a transvaginal ultrasound. We'll get you those numbers that you need to make decisions. And please feel free to use this code either at Vios or Kindbody. You can go to kindbody.com and book an appointment, or same with Vios Fertility. Just mention the promo code with Vios and Kindbody. You'll be able to type the promo code in at checkout. So we'll be sending a follow-up email with all this information, but just wanted everyone to have that before we move on. So let's go to another question. Dr. Jelani, why do some IVF protocols require starting on birth control? And how long after a retrieval is a frozen embryo transfer done with PGT testing?
So some clinics you do things differently. Everyone's diagnosis is different. Birth control causes a suppression. So if you're prone to cyst formation or an elevated hormone profile, it's best to suppress or get a good grasp of that before you start treatment. So some clinics start with birth control for that reason. And then you can immediately go into a transfer after the following month after you've done IVF, depending on how the clinic is structured. So if you're comfortable moving along while your PGT biopsies are pending, then we start you for prep after your period to then do a transfer. And some couples want to know answers before they start, so they can do a retrieval, take a cycle off, and then do a transfer. I always talk to my patients about short-term goals and long-term goals. So if your long-term goal is to do family building, then it's best to do a couple of retrievals, meaning a retrieval while your PGT results are pending before you go into that transfer.
Great, thank you so much. What is another question? What makes someone a candidate for a fresh transfer versus a frozen transfer? Dr. Jelani, while we have you here.
So ideally, we talk about it's hard to align your uterus and your ovaries. I always tell patients that even though we think of them as one big system, they're two separate organs and they react very differently to hormones. So when you're trying to bundle it all in one cycle, then you're trying to focus a little bit on the ovary and a little bit on the uterus. And I can tell you when I try to multitask, I'm not very good at it. And just like that, for our body, I always say focus on the ovary, get a period, and then let's focus just on the uterus. But if for some reason your embryos are not making it in culture in the lab, or you're moving, or whatever that may be, that gives you that time constraint where you're trying to fit it in 1 month, then a fresh cycle. But ideal is best to do one thing at a time. Slightly higher success also.
Thank you. And Dr. Ekpo, can you have a period? Can you have your period and not ovulate? Can you not be ovulating and still bleed?
Yes, you can. Typically, you're bleeding sporadically, so when your periods are not predictable, they're happening randomly. Like every, you have a period 15 days after the next one. There's a good chance that's not an ovulatory cycle. When you ovulate, 98% of the time you get a period. However, you can get a period without ovulating. So you want to track ovulation if you can with ovulation predictor kits, which you can purchase over the counter. You pee on a stick and it tells you if you're ovulating. So having a period that's predictable is a good chance that you're ovulating. So predictable meaning I get my period every 28 days, or I get my period every 30 days. That's consistent, but I get a period 15 days, the next time was 25, the next time was 30. You may be bleeding because your uterine lining is shedding just because it's thick. Doesn't mean there's an egg there to be fertilized.
Mm-hmm. Okay, thank you. And then also another question, does age make a difference in live birth rates of FET? So if, for example, if I use frozen embryos retrieved at age X, is there a difference in using the embryos at age Y versus age Z?
The difference in the success rate of an embryo that's genetically normal leading to a pregnancy is based on the age at which the egg was created or the eggs were retrieved, right? So if it's a younger egg, that embryo is more likely to be normal. Once you know that it's genetically normal,